Hi, welcome to another edition of Health with Patricia. With me, Patricia Roxanne Hammond. My guest is Dr. Promise Sepoga. He's a consultant obstetrician gynecologist with Shape Healthcare and Medical Center. He's also a senior lecturer at the University of Ghana Medical School. Today, we're discussing ectopic pregnancy. Hi, thanks for another opportunity.
Yes, it's always a pleasure to be a part of this.
What actually is ectopic pregnancy?
Yeah. So ectopic pregnancy basically refers to pregnancy that occurs outside of the womb. Right. So we expect that when a woman ovulates, the egg is released from the ovary, either from the right or from the left. The egg is supposed to travel in the tube, meaning the tube has to be perfect.
Okay.
So that along the journey of the egg, the sperm goes to meet with the egg. It fertilizes the egg to form the pregnancy. In the natural scheme of things, that fertilized egg, which we now call the embryo, is supposed to travel through the tube down, settle here inside the uterus, and develop into a baby.
Okay.
After 9 months, the baby comes out. And we have outdooring, we have a bag. Now, under some conditions, the pregnancy which is formed gets stuck inside the womb, inside the tube here. Okay? Or it is formed here and it gets stuck there. Instead of traveling to come and settle here. And so, any pregnancy which is occurring outside of the womb is called ectopic. Ectopic means it's at the wrong place or outside. Okay? And the commonest place for majority of the ectopic pregnancy
It's in the tube.
is in the tube. So the tubal ectopic pregnancy is the most common. Now, you see that the wall of the womb is very thick.
Yeah.
It's thick because the Almighty Creator made it so that as the baby is growing, this can stretch from nothing in it to a size where it contains the full baby without tearing apart. This tube is very thin, the wall is very thin, so as the baby begins to grow there 6, 7, 8 weeks, it cannot contain, it would burst. And that is why the tubal ectopic pregnancy would burst. We describe it as a rupture, a rupture. And that goes with a lot of bleeding. The pregnancy bursts, there's a lot of bleeding from that, and the blood accumulates in the woman's abdominal cavity. So typically, this woman within the reproductive age group, she would have missed her period for about a month, 2 or maximum 3, suddenly feels severe lower abdominal pain, and in most chances they collapse. Because massive bleeding, they collapse. Meaning she's losing blood actively. And if that woman does not get to hospital promptly, she stands a huge chance of losing her life.
What makes a tube perfect? How is the tube supposed to be? I know it's thin, but the inside of it, the lining, how is it supposed to be like? Is it smooth or is it hairy, or what makes it perfect in order to?
I mean, the perfect tube is that there's nothing blocking it. And the tubes have some hair-like projections inside which help to move the fertilized egg into the endometrial cavity. But some previous infection that a woman may have experienced can damage all those hair-like projections. And as a result, the inside of the tube becomes raw with scar and it doesn't have the hair-like projection. So then the pregnancy, the embryo cannot be moved in there.
Okay.
Sometimes previous infections again could cause areas of the tube to be stuck. The sperm is able to squeeze its way to meet the egg, but then the fertilized egg cannot move back in there because the tube is damaged from previous infection.
Okay, I get it.
Those are some of the reasons why the tube will lose its function and become a high risk factor for tubal ectopic pregnancy. Sometimes, as a result of this same infection, the tube is completely blocked.
Whew.
And so, pregnancy cannot happen at all.
Infection is what causes it makes the tubes to get blocked, right?
Majority of the
Infection.
tubal blockage or tubal damage is from infection. Some of this infection could just start off as a vaginal discharge, which is offensive, which is yellowish, but if not treated, then it can go up, and then the bacteria damages the tube. Sometimes somebody got pregnant and they're not really prepared for it, and then instead of going to the appropriate healthcare center to have a professional termination done, they just take something to terminate it themselves without any further antibiotic treatment to prevent those infections, and they suffer infections that will damage the tubes, and in future, ectopic pregnancy, or if the tube is completely damaged, inability to conceive.
That's terrible. So, who is at risk? Is it a first timer or someone who has?
So, any woman.
Any woman at all,
Unless the woman,
irrespective of the age.
Yes, any woman within the reproductive age group, from 15 to 49 years. Any woman in that age group, once she has a tendency to get pregnant, she has a tendency to have ectopic pregnancy. So as a matter of fact, we teach medical students and young doctors that any woman you see come to the hospital, assume she has ectopic pregnancy until proven otherwise. Just so that you don't lose sight of that, because it is something that can easily be there, and if you don't go the extra step to look out for it and detect it early, it bursts and becomes a life-threatening emergency. You can imagine that the woman lives so far away from a hospital, develops an ectopic. If we are lucky to do a scan, ultrasound scan early in the pregnancy, we're able to determine that this pregnancy is outside the uterus. Let's do something about it quickly. Otherwise, the woman is living so far away, she's pregnant, hasn't reported to hospital to get checked, and the thing is there, and it bursts in the middle of the night. She collapses in pain before they find transport, before they navigate to hospital. Every minute she's bleeding. She's bleeding her life away, you know. And if she doesn't get to hospital promptly, where we open up, get in there at surgery, and stop the bleeding, she's losing blood. And every human being, adult, has about 6 liters of blood in your system. When you bleed half of that, you are nearly gone.
At what week is the baby, like, is the scan able to pick the baby? Like, you know that this is a baby in the sac?
From about 5 weeks.
5 weeks.
We can see something and be able to tell the location. The most important thing about that first scan is to tell the location. Okay, the pregnancy sac is inside the uterus. We are happy.
Okay.
Right? So that's the whole point about when you miss your period, try and go to the hospital as soon as possible. Because you do not know the location of that pregnancy.
Okay.
Okay, it's only through the scan or sometimes some repeated blood tests we're able to predict, okay, it's at the right location, so we are good. But if you sit at home, you don't know what you're sitting on.
Ectopic has ruptured. You've been treated, discharged, you go home. You are hoping to conceive again. Mm-hmm. What can be done to help you? Is it like, should it be reproductive help, or she can still carry the child again?
Oh yes. So if the ectopic affects this tube and the tube is ruptured, dealing with that problem means we're going to have to remove this tube. So you don't stand a chance of conceiving when you ovulate from here, because the tube is gone. So anytime you ovulate from here, you cannot get pregnant. Your chances of conceiving depend on your ovulation from the other side. Okay? So then your chance of conceiving are reduced to some extent.
Okay.
But once the pregnancy comes, you still stand, because you've had one ectopic before, theoretically there's a higher risk of you having ectopic here again.
Oops.
And so you are the candidate who should promptly report once you miss your period.
So is it that every reproductive issue or anything in relation to the uterus, like of a woman, it tends to repeat itself? Like there is no cure. You're just managing
Yes.
from hypertension to fibroids to ovarian cyst to ectopic. Everything keeps repeating.
So once you have it, there's a higher likelihood that it may happen again.
That's not fair.
I mean, it is fair to the extent that it helps us to take precautions. Do you understand? You have had an ectopic, and once you've gotten pregnant, promptly report to hospital. Let's make sure that it's not another extra uterine pregnancy. But let's confirm that this time around it is here. Okay. In case it is outside, then we're able to deal with it promptly before it gets to the stage of rupture. And sometimes we just give some injections to stop it from developing.
Okay.
Sometimes we do what we call laparoscopic surgery. We don't having to cut open and then to take it off.
So in a case where, okay, let's say both tubes are blocked now, you still ovulate, but you can't conceive. So in this case, you just have to help the woman either get someone else to carry,
No,
or
if both tubes are damaged or removed from ectopic, or both tubes are blocked and they cannot be opened, then we give the woman medications, injections. When the eggs are ready, we take the eggs out,
okay,
get a sperm to fertilize these eggs, and that's what we call in vitro fertilization,
okay,
or IVF, to form the pregnancy in the special IVF lab before we put a pregnancy here.
okay. Thank you very much, Dr. Sepoga. Ectopic pregnancy is deadly. This one I wouldn't say is problematic. is potentially deadly and life-threatening.
Yeah.
Please. So anytime, as doctor said, anytime you miss your period and you find out you're pregnant, please visit the nearest hospital or come to Shape Healthcare and Medical Center. A scan will be done to detect if baby is the embryo
Yes, the right location.
is in the right place, either in the tube or in the uterus. And you call it something cavity. The uterine cavity, just to ensure that the baby is in the uterine cavity and not in the tube. Please, it's very important, and I'll say again, don't take it for granted, because ectopic is life-threatening and very deadly. The show has been Health with Patricia. I believe you have been educated. And my guest has been Dr. Promise Sepoga. He's a consultant obstetrician gynecologist with Shape Healthcare and Medical Center. He's also a senior lecturer at the University of Ghana Medical School. My name is Patricia Roxanne Hammond. At the same time, stay blessed.